Once a patient comes to see us, most of the time they have been through many, many diets. They have undergone many, many different treatments. And many times when they come to us, they are kind of lost.
I was feeling very desperate. I had my daughter, and I would just stay inside the house with her watching TV, and I felt I really don't want this life for my daughter. I want her to move, I want her to bike outside, I want her to run outside at the park, I wanted her to be proud of her mother.
I know I was handicapped with all the weight, and I had 4 or 5 other weight-related physical maladies that kind of went along with it, and it was just time to do something with it. I know I wasn't going to last long.
I've been overweight pretty much all my life. Tried dieting since I was a kid.
It was a pretty lonely time. A little depressing. It's a big, scary decision to admit that you have a problem and that you are not able to take care of it on your own.
One of the things that's common in this line of patients is they've tried and failed many, many times in the past, and a lot of them have given up. Or other providers or other family members have focused in on it's your fault. You eat too much, that's why you're overweight, and it's your problem, and you can't be helped, which is not true.
Yeah, I think our staff is great at making patients feel welcome, feel at home, and feel comfortable with discussing their fears and their anxieties and just the not knowing what to expect.
When a patient comes in here, they get seen by every single discipline, the surgeons, myself representing internal medicine, dietitian, psychology. So for the patient, it's a matter of convenience from day one.
The team that they put together, it's not just a surgery. It's really kind of changing your lifestyle and getting you to change your habits and having a really big support system here.
You have truly the experts in our respective areas working as part of a team. We are the people who are doing the research. You have the surgeons who are training other surgeons around the world to do these surgeries.
And not only we offer every type of possible surgery today, but we are evolving with new surgical techniques. So we are not stuck with one operation.
By having that drive towards innovation, having the academic environment, we can do things like restore a gastric bypass with only an endoscopy and no incisions. That's pretty unique. We have protocols where we can do primary bariatric surgery just by going through the mouth and without incisions. We have access to technologies and devices that not every center has access to. And the reason we have that access is we have the expertise and we have the facilities to help develop the treatments of tomorrow.
Surgery is not a magic fix. It's going to take 50% from you, 50% from the procedure, and that's a lot. That means you still have to exercise, you still have to choose the right foods to put into your body. It's not just that you're going to have surgery and then we're going to say, see you, bye-bye. We're going to see you out through the process.
Follow-up is very important. In fact, the patients that we see following up on a regular basis are our most successful patients. So those that come to monthly support group or coming to the clinic every 1 to 3 months, they usually are the ones doing the best because they have that support from us.
Because it's not only a weight issue, it's also a mental issue because your body changes so much, your life just changes so much that you really need that. You really need somewhere to go to talk to people about the experiences you went through.
We're like a family. There are people in the group that both pre-op and post-op and all get together and share their experiences and give advice back and forth and support each other, in addition to the staff being there and giving you the same support and advice.
We see patients before surgery and the changes that they make, and then we actually get to see their success afterwards. And that's one of the things that really drew me to this as a specialty, because seeing the impact that we actually are able to make and the help that we're actually able to provide to these folks over a long period of time is very, very rewarding.
There's a lot of patients that we see and they'll walk in the door one day and I don't even recognize them because they've changed so much, not just physically, but mentally. They're happier, they're thinner, and they just feel like they have a new life. I saw a lady today and her blood pressure is fantastic, and her primary care physician was excited that she doesn't have to take her blood pressure medicine.
And that's what I think we both like to see, both the physician and the patient, is to see an improvement of their health so that we start taking away medications rather than adding more. I think that's the bottom line from our perspective, is that we don't view this necessarily as a cosmetic endeavor. It's really to improve your health and significant improvements in quality of life.
We have patients that encourage Natalie and I now when they come to group to get involved in a marathon or some type of race, when we were the ones encouraging them before to just walk a mile or walk for 15 minutes, and now they're the ones encouraging us to do something.
I feel like I can do so much more. I mean, just in San Diego, there's so many beautiful places to hike, and I just want to discover every inch of the city.
I never felt this good in my life, and people have told me, they've said, geez, you must feel like you're 18 again or something. I said, no. When I was 18, I was fat. You know, I mean, I have never felt this good.
I remember going into surgery, being wheeled into the operating room, and the gentleman pushing my bed said, "Are you ready for the change of your life?" And it has been. It's been the change of my life. It's a different life for me.
You really have to believe in yourself, and you really have to be willing to make a change, and it doesn't come easily. But it's wonderful here because you have people that care about you and that want you to succeed and don't just want to take your money and run.
This is a very brave move, and I really have this deep respect for them for making this. This is a person saying, I need to save my life, and I'm glad that I'm here at that moment to help them.
To me, that's one of the beauties of doing this type of surgeries and treating this type of patients, because it's like a new horizon is out there for them. And when you have that to offer, it's an unbelievable experience.